The Centers for Disease Control and Prevention, or CDC, made an unexpected announcement that has caught many by surprise. They are launching a comprehensive investigation into the potential link between vaccines and autism, a topic that has been hotly debated for years. This decision comes amidst a growing measles outbreak that has raised public health concerns across the nation. It also follows years of public debate and concern over vaccine safety, with many parents and advocacy groups voicing their fears and demands for more research. The CDC's announcement has reignited a complex and often emotionally charged discussion, bringing it back into the spotlight. The CDC emphasizes that vaccines are safe and effective, a message they have consistently communicated to the public. They have repeatedly stated that vaccines do not cause autism, based on extensive scientific research and evidence. However, the agency acknowledges the need to address public concerns and the ongoing debate. They hope this new investigation will provide further clarity and reassurance to the public, helping to build trust in the vaccination process. This investigation is not the first of its kind, as the CDC and other organizations have conducted numerous studies on this topic. Numerous studies have already explored the potential link between vaccines and autism, with rigorous methodologies and peer-reviewed results. These studies have consistently found no evidence to support a causal relationship, reinforcing the safety of vaccines. Despite the scientific consensus, misinformation and fear persist, often fueled by social media and anecdotal reports. The CDC's decision reflects the challenges in combating vaccine hesitancy and the importance of addressing public fears with factual information. It underscores the importance of clear communication and evidence-based decision-making in public health, aiming to protect communities and ensure their well-being. The origins of the vaccine autism debate can be traced back to a now discredited study. In 1998, Andrew Wakefield, a British gastroenterologist, published a paper in The Lancet. This paper suggested a link between the MMR vaccine and autism. Wakefield's study was small and poorly designed. It was later found to be fraudulent and was retracted by The Lancet. Wakefield lost his medical license. Despite this, his work fueled a wave of anti-vaccine sentiment. The damage, however, was done. Wakefield's claims spread rapidly, amplified by media coverage and celebrity endorsements. Parents, understandably concerned for their children's well-being, were left confused and frightened. The legacy of Wakefield's fraudulent research continues to cast a shadow over public health. It has contributed to declining vaccination rates and a resurgence of preventable diseases. Measles, a highly contagious and potentially deadly disease, was declared eliminated in the United States in 2000. This remarkable achievement was the result of widespread vaccination efforts. However, recent years have seen a concerning resurgence of the disease. Outbreaks have been reported across the country, linked to pockets of unvaccinated individuals. The decline in vaccination rates, fueled by misinformation and fear, has created an environment where measles can spread easily. Measles is a serious illness, particularly for young children. It can cause pneumonia, encephalitis, which is brain swelling, and even death. The resurgence of this preventable disease is a stark reminder of the importance of vaccination. The CDC's decision to investigate the vaccine autism link comes at a critical time. It highlights the urgent need to address vaccine hesitancy and protect public health. Robert F. Kennedy Jr., an environmental activist and vaccine skeptic, has been a vocal figure in the vaccine debate for many years. His outspoken views have made him a controversial figure in public health discussions. Kennedy has long promoted the debunked claim that vaccines cause autism, a theory that has been repeatedly discredited by scientific research and numerous studies. He has used his platform, including social media and public appearances, to spread misinformation and sow doubt about vaccine safety, influencing many of his followers. Kennedy's involvement in the vaccine debate has been widely criticized by health experts, who argue that his claims are not only false but also dangerous. They argue that his claims are not supported by scientific evidence, pointing to extensive research that shows vaccines are safe and effective. They also express concern that his influence contributes to vaccine hesitancy, which can lead to outbreaks of preventable diseases. Despite the lack of scientific backing, Kennedy's views have resonated with some segments of the population, particularly those who are already distrustful of mainstream medical advice. His celebrity status and his family's legacy have lent him a degree of credibility among those distrustful of mainstream institutions, making his message more impactful. Kennedy's continued advocacy against vaccines raises concerns about the spread of misinformation, which can have serious public health implications. It underscores the challenges in combating unfounded claims and promoting evidence-based health decisions, highlighting the ongoing battle between science and misinformation in the public sphere. Section 5. Voices of Reason. Health experts have been quick to respond to the CDC's announcement. They emphasize the safety and efficacy of vaccines. They also reiterate the lack of scientific evidence linking vaccines to autism. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, has stated that vaccines are one of the greatest public health achievements in history. He stresses that the benefits of vaccination far outweigh any potential risks. The American Academy of Pediatrics, or AAP, has issued a statement reaffirming its support for vaccination. The AAP emphasizes that vaccines are rigorously tested and monitored for safety. They urge parents to vaccinate their children according to the recommended schedule. The consensus among health professionals is clear. Vaccines are safe, effective, and essential for protecting public health. Section 6. Separating fact from fiction. The debate surrounding vaccines and autism often becomes mired in misinformation and emotional appeals. It's crucial to approach this issue with a critical eye and rely on credible sources of information. The CDC, the World Health Organization, and other reputable health organizations provide evidence-based information on vaccines. These organizations are committed to promoting public health and ensuring vaccine safety. When evaluating claims about vaccines, it's important to consider the source. Be wary of information from individuals or groups with a vested interest in promoting a particular agenda. Critical thinking skills are essential in navigating the complex landscape of health information. By relying on credible sources and engaging in thoughtful analysis, individuals can make informed decisions about their health and the health of their families. Section 7. The weight of evidence. The scientific evidence overwhelmingly supports the safety and efficacy of vaccines. Numerous studies, conducted over decades, have consistently debunked the link between vaccines and autism. A 2014 meta-analysis published in the journal Vaccine reviewed data from over 1.25 million children. The study found no association between the MMR vaccine and autism. Another large-scale study, published in the New England Journal of Medicine in 2019, followed over 650,000 children in Denmark. This study also found no evidence to support a link between the MMR vaccine and autism. The weight of scientific evidence is clear. Vaccines do not cause autism. The CDC's decision to investigate this issue further, while well-intentioned, may inadvertently lend credence to unfounded fears. Section 8. The importance of trust. The success of vaccination programs relies on public trust in health authorities. When trust erodes, it can have serious consequences for public health. The spread of misinformation and the amplification of unfounded fears can undermine confidence in vaccines. Building and maintaining trust requires transparency, open communication, and a commitment to addressing public concerns. Health authorities must engage with communities, listen to their concerns, and provide clear and accurate information. It's also essential to acknowledge the historical and social factors that contribute to vaccine hesitancy. Addressing systemic inequities in healthcare and building trust with marginalized communities is crucial. Section 9. Protecting our future. Vaccines are one of the most powerful tools we have to protect ourselves and our communities from preventable diseases. They have saved countless lives and continue to be a cornerstone of public health. The decision to vaccinate is a personal one, but it is a decision that has far-reaching implications. It affects not just the individual, but also their family, friends, and the broader community. By choosing to vaccinate, we not only protect ourselves but also contribute to herd immunity. This collective protection is crucial in maintaining public health. Herd immunity occurs when a sufficiently high percentage of the population is immune to a disease, making it difficult for the disease to spread. This is especially important for those who cannot be vaccinated. This protects those who are unable to be vaccinated, such as infants, pregnant women, and individuals with compromised immune systems. Their safety relies on the immunity of those around them. The CDC's investigation into the vaccine autism link, while unlikely to yield any new insights, provides an opportunity to reaffirm the importance of vaccination. It underscores the need for ongoing research and vigilance. It is a reminder that we must remain vigilant in combating misinformation and promoting evidence-based health decisions. Accurate information is key to making informed choices. The health and well-being of our communities depend on it. Together, we can